You do? Hey there, can you hear me? Hey, can you hear me? Hey there, I'm still trying to figure this out, so sorry if this is a little confusing. Can you please type in the chat if you can hear me? Okay. I'm gonna go ahead and start the webinar. Okay, so this webinar is about improving the lockout and the snatch and just using the rehab perspective. Okay, so then, okay, so what I want you to get out of this is to have a new perspective on why press out may occur. This is because most weightlifting coaches see things from a weightlifting coach perspective in the overall scale. They just see people pushing out and don't really think they can only see it from one perspective. My goal is to see it to help you see it from a physical therapist perspective and to be able to use a physical therapist point of view for programming accessory exercise for rehab accessories. And ideally, this will help weightlifting coaches and athletes program accessories that better target why press out occur beyond just doing push press or dumbbell press or whatever. Now, this is going to be the overview of what we're going to go over. First, as you can see, we'll see this is the general layout. We're going to assume something, go over anatomy, explain how the process of rehab is for a physical therapist, go over some potential causes, and then explain how we can use physical therapy concepts to help your programming and lockout. And then we'll finally have a case example. Okay, so first we are going to assume the athlete has good jerk technique. So a lot of press out occurs because the athlete has a poor jerk technique or poor timing or they just don't fully lock out. We're going to assume that is not the issue here. We're going to assume that the athlete has several years of weightlifting training experience, has good technique, is consistent, and does not have stupid programming because a lot of programming is really dumb and encourages the athlete to develop bad technique to compensate for poor programming. So it's important to note that just because somebody is pushing out, it does not mean that there's something wrong with an athlete's shoulder. It's just simply another weak point that can be improved, just like strengthening the lower back or more quad strength or whatever. So here's some relevant anatomy on that can contribute to why press out occur. So here the thoracic spine is the first thing we should check because if somebody does not have good thoracic spine mobility, they are not going to be able to have a good overhead position. They are going to have a jerk position that's like this in front and a lot of leaning back. I'm pretty sure you've seen a lot of people in local competitions that have a weird looking jerk lockout where they just lean back a lot and go forward almost like they're doing an incline bench press jerk. The second thing is the shoulder girdle And from what I see, this is usually what the most common cause of it, because as you can, there it composed of multiple muscles, and the way the whole shoulder is designed is pretty easy to compensate for one part of the shoulder with another part of the shoulder. And this compensation can be either good or bad. In press out, we usually see a compensation because of an inadequate shoulder girdle strength, or something else has to take up the impact of it. And then the last main one is the rotator cuff. Usually, we will see rotator cuff as a source of as a potential contributor, usually after a shoulder injury. And then after a shoulder injury, pretty often we develop a motor pattern to avoid the shoulder pain. And then that motor pattern sticks around, and we don't really rehab this rotator cuff. So we end up sticking with the compensation to that's after the injury, but that compensation causes a long-term negative performance impact. And then now the less likely sources of issues is like tricep strength, delt strength. I don't think this is more of a secondary or tertiary thing, because we got a lot of tricep stuff, a lot of delt stuff simply with the nature of weightlifting. We do a lot of push press and pressing in general, and that typically take care of that just fine. A lot of people have tight lats, which means they have a hard time getting a good position overhead, and they often only see it at a higher percentage, and that's usually because at the end range of motion they have poor strength at the end range of motion. So simply by strengthening the end range of motion like this part will help a lot. Okay, so now that I cover anatomy, does anyone have any questions about the anatomy so far? Or does anyone have a hard time understanding me? Okay, great. So now physical therapists are trained to find potential limitations on a micro scale from the grassroots scale. We can use this viewpoint to find weaknesses as specifically as possible. That's holding back the big picture. And in this case, this is for improving the snatch and lockout. Right? That's great that you guys are not having a hard time understanding me. Okay, so now we all know as weightlifting coaches and fit and athletes that other process of getting better at weightlifting is simply like get stronger, do stuff that has high carry over. Like if you're weak at lockout, it's really common to program push press or just simply overhead pressing and so on. So by this perspective, it's an overall perspective in the sense like the athlete has a hard time locking out. So we just simply strengthen the whole thing, the general movement. Now for a physical therapy, we want to see from instead of the top down, we want to see from the bottom up and see why there is a weakness. Now, and then there is also a different process of getting stronger and better to get back to the previous goal. So when an athlete or patient gets injured, we we try to break it down into something very simple, like pretty often it's just too simple, like doing clamshells. That's not going to do shit for most athletes. But the idea is that we break it down into something simple and then slowly ramp it up, bring it up to our goals. Now, weightlifting is pretty complex, and this is where I find where a lot of PTs, even though they're knowledgeable in CrossFit or weightlifting, don't really do well enough. They will give us some exercises and so on, which will help a lot, but then there is not enough for bridging the rest of this process. So what happens is that the inner exercises that we are given don't transfer to the snatch and jerk or anything weightlifting related. We need to have like the whole process of like crawling, walking, running, jumping, but a lot of people just go from crawling straight into jumping, and that just does not work for weightlifting at all. This is a pretty similar process in weightlifting. You know how when you first learn weightlifting, you learn a very simple um, process. Like for just people learning from overhead press, push press, and then going on to split jerks. So this is a similar concept we need to do for rehab in order to really apply rehab concept to performance. Now for thoracic mobility limitations, like I demonstrated earlier, but it just looks like a person leans back and just like this, or when somebody has a hard time having a good front rack position, they will look like this, and they'll have a kind of leaning back, and they will have a hard time having an open chest. If you have good thoracic mobility, you'll be able to do this with a big open chest and much stronger upper back and lat bracing. And that's how you can tell when somebody has good, acceptable thoracic mobility. If the thoracic mobility is limited, it means having the lockout overhead much more difficult. To improve this, we need to have improved thoracic mobility and range of motion strength. And then this is where I see a lot of coaches and physical therapists miss out on. Weightlifting is a strength sport. We use weights. We are lifting weights overhead, but a lot of mobility exercises don't involve loading, resistance, or whatever. They just involve you using the body weight to move around, do thoracic exercises, and that's will not transfer very well for weightlifting or strength sports in general. It needs to be resistive. For example, like thoracic rotation open book is a pretty popular exercise. In order for it to really apply to weightlifting, we need to do it with the band, resisting it, and so on to really be able to apply and improve end range of thoracic mobility so that it can apply to weightlifting. So Bats asked a question: front rack hold a good exercise or progression for thoracic mobility as opposed to just strength? I would say yes, if they can get close to the front rack position as desired. And then after you get used to getting a good front rack hold, getting used to bracing with a big open chest, then you could progress onto jerk dips. If you have a hard time applying a good front rack hold and position, and you try to go straight into jerk dips, it's going to be much more challenging to apply jerk dip to weightlifting. So that's what we want to make sure that we're able to do something decently competently before progressing onto something that's more specific like jerk dips. Does that make sense? All right, now for shoulder girdle. Now this is really common. I would say this is most of the time people have a hard time locking out because the shoulder girdle weakness or lack of capacity. And then that will show at the person elbow lock bending to make it easier on themselves, and it usually looks like this. Once shoulder is lower and the elbow is bent so that they can hold on to the weight. And then obviously we don't want that because that's the press out and then you get beat red line. And then luckily this is actually really easy to identify. We just need to do like exercises that target shoulder girdle stability or strength. Like a lot of people have like shoulder pain when they do stuff that load one shoulder like side planes. I had this issue like when I would do side planes, my shoulder would hurt and I wouldn't know why. And then it was only until years later I realized I was picking up my shoulder girdle. It wasn't picking up my delt or anything, but it was my shoulder girdle. And then we can see other stuff like scapular push-ups. I've seen some really strong lifters that just like 140, 150 have a hard time doing scapular push-ups, and that could be really surprising. Handstand hold is another really great exercise for weightlifting, a completely underrated exercise that hits the shoulder girdle really well. And if you have a poor shoulder girdle strength, this exercise will really hit it hard. Now I know that shoulder handstand push-up are almost like um, flip upside down shoulder pressing. But with shoulder pressing and so on, like overhead press and so on, it's actually pretty easy to compensate for shoulder girdle strength and use your delt or rotator cuff or something else to get the bar overhead. And that's a compensating mechanism because our bodies want to do whatever is easier to get the work weight overhead. So we develop a pattern that's not optimal for long-term performance. Then, no, so I think I talked about this earlier, but we want to do exercises that really target the shoulder girdle more and make it harder to compensate for lack of shoulder girdle strength. The exercises I like the most are handstand push-up or handstand hold against the wall. But when you do these, make sure that your arm is behind the ear and head like this, because if you're doing it like this in front, it's not really close enough to the juggler snatch grip position overhead. The other really popular one I like is overhead kettlebell carries with the scapular press while walking. This is one of those exercises that will really tell the athlete if they have a weaker shoulder girdle because they will often notice a huge difference between one side. So, and then we don't only want to do overhead, we want to do all ranges of motion. Some other good exercises are like push up with scapular push up and weight push up and so on. Now, rotator cuff, the elbow bent at high intensity, or you'll notice that the wrist has to take on more loading, but sometimes you'll still see them, they won't have like a dip in their shoulder, but they'll have like a bent elbow and press their elbow anyway. This is one of the easier things to fix because you just need to strengthen external rotation, which is like this part movement. And it should ideally be parallel or ahead like this. If it's at the side with the band, it's probably not going to apply very much to weightlifting and we're just wasting time. Now, does anyone have any questions about the potential causes and what they will look like in lifting? Okay, now I'm going to go on to the process that we have. Now, the stuff I mentioned earlier are simply it depends, but that's one of the things that, Bass asked a question. For 90-90 shoulder external rotation, should the elbow be supported or unsupported? This is not something that's super important. What's important is that it hits the rotator cuff and you feel it in the rotator cuff. And As long as you do that, that's what matters. If you can just if doing a supported help hit it harder, then do it supported. If you're not sure if to do it supported or unsupported, do it supported because it's harder to accidentally cheat or compensate with supported. Okay, now I'm going to talk about the process that we have. So what I just talked about with the different exercises, that's only the early part of rehab. Now, it's the early part of rehab because what I just discussed is more general strength stuff. And it's more general strength stuff because it's not specific enough towards weightlifting. This, but however, sometimes just doing the general kind of weightlifting specific stuff is enough to fix the problem. And if it is, that's great. It makes things a lot easier for everyone. But also often it's not enough. We need to do more steps to transfer the strength to help improve motor pattern, to improve technique, and then we'll really be able to apply it to the snatch and jerk overhead. Like I said earlier, after weakness happens after an injury and after compensating to avoid pain, and often that compensation sticks around. For example, if somebody hurts their ankle, they're gonna limp around to avoid pain, and then sometimes that makes them keep that movement pattern, and that's not optimal for performance. So the early part is the first part of it, and the next step is to start applying more specific but simpler weightlifting stuff. Like for example, if somebody have a shoulder girdle weakness, we do shoulder girdle stuff like handstand hold or scapular push up, and then after that, you want to start applying that new strength gain through more specific exercises. For example, like jerk recovery is great because it's simple, technically simple, and you can focus on having a sort of lockout overhead while you're doing the jerk recovery. Same thing for overhead squat or snatch balance and so on. The idea here is that you transfer it to a simpler weightlifting exercise and then transfer that simpler weightlifting exercise towards the snatch. I mean, this is a very similar process for getting better at weightlifting. So the hard part is the execution of it. The hard part is identifying what the athlete needs to work on, muscle wise, movement wise, or whatever, and then find the right entry point in order to be able to program an exercise that's not too hard, not too easy, enough loading, so that they can start the process of rehab for performance. It's important that the exercise needs to be challenging. If you do like 10 reps of handstand push up and you feel like you could do 10 more reps pretty easily, then it's not hard enough. It needs to be harder. It needs to be at least OPE 7 for an exercise to be effective and not a waste of time. And then, but because the exercise needs to be challenging enough, we also need to take into account the effect of the exercise into the overall programming load. If we just have the weightlifting programming and the accessory, and then the rehab stuff, that can potentially cause problems, especially in a competition, because it turns out the athlete is doing a lot more stuff than originally envisioned, and that can interfere with training, and we don't want that. So, and on this flip side of the coin, we want to see how weightlifting programming effectively have exercise performance in terms of tracking progress over time for the rehab exercise. And it's a also makes sense. Like you want to have the main weightlifting programming support the accessory exercise, not make it harder to apply to snatch or jerks. Okay, before I go into the case example, does this process that we have make sense? And do you have any questions on this or anything so far? Okay, I'm going to go ahead and go on to the case example. So let's say A has a tendency to press on his left arm at high intensity jerks, and then he's cleaning just 150 at the 102 weight class, so he has pretty decent numbers, and we'll assume that he has decent technique, and we're not going to blame his technique as why he tends to press out. No, I'm going to clarify. It doesn't necessarily have to mean it's technique related or strength related. It's going to be a combination of both technique and strength that causes lockout or any other issues. Okay, all right, back to the case example. So we check out his stuff. The main difference is shorter guard strength, and he has difficulty doing handstands against the wall. Does anyone have any input or want to say what the programming strategy will be? There's no shame in being having a different opinion than me. Okay, now I'm going to go over to the case example on what I would do. So for the main programming, I will have just tripled at RPE 7 or 8. Usually that means just tripled at 70, 75%, or maybe 80% with the focus of pausing receive. Bass said shorter guard strength struggle, maybe doing pike workouts and handstand hold. Yes, that'll be a good first step. And that'll be a good first step to do and see what we can do to help the athlete. So for the main programming, we will want the jerk triple to reflect our goal to really emphasize the lockout for the shorter girdle. So that's why on the last rep after jerk recovery, we want to hold the lockout with a strong focus on keeping the shoulder girdle pressed out strongly overhead, not like this, but lock out. And that's part of the motor panel learning, technique learning. And then the accessory programming, like what Batch said, they're going to be to put overhead stability, which is going to include pike walkouts, which is good. And then for general shoulder girdle strength, handstand hold against the wall, handstand push-ups will be really good. And that's going to be the good first part that we have. And then as things progress on, usually like a few weeks or maybe a month or two, as we continuously increase the weight and resistance of the exercise, we'll slowly progress onto jug singles at RP 8.5, 8, which is probably about 85%, 90% with a 5-second hold. And then ideally, what will happen is that the earlier part of rehab exercises and the judge triples earlier on both work together to help make the just singles much stronger, much easier to do to lock out. We also want to progress the accessory exercises by doing a harder version. For example, handstand push up, handstand hold against the wall to handstand push up, or increasing the weight, from like 10 pounds to 20 pounds and so on. And then just recovery. We will be progressing one of the exercises to just recovery. This is when I say just recovery, this is the progression from rehab exercise to a lower level weightlifting exercise. And this, when I say lower level, I mean lower level technique wise, but still weightlifting specific exercise. And then the final goal here is to continuously progress the ancestry programming and secondary weightlifting programming to support the main class lift programming. So there is no one right way. What matters is the principles, how you load the shoulder, how you apply the exercises, and all that to make progress. There's no one magic exercise. There's no one magic process to get what we want to go. So now, does any of this sound familiar to you? If you want me to help you in helping improving performance, especially if an injury, just message me. I want help, and we can figure out if we can be a good fit to work together. Now, because a lot of this super common in patients, super common in athletes after an injury, even years after an injury, because pretty often these injuries or whatever are not rehab well, so the compensation patterns stick around, and with those compensation patterns, it becomes a lot harder to actually target what's causing the performance issues. Now, does anyone have any questions about the webinar so far? Any questions about what we discussed? Thanks for the compliment. It's a Facebook user, so I'm not sure who said that, but I appreciate your kind words. Okay, so sort of. So earlier on, a few days ago, some in the Q&A, somebody asked me why he was still having medial elbow pain, which is like this area pain overhead right here, and then Bash, give me your email. Oh, no, I just need your email, then I'll send you the presentation. So, okay, so back to a question I had a few days ago. Somebody reported having medial elbow pain, which is like in the elbow pain in the circle, snatch overhead, and the person reported trying with cord and so on, but it wasn't very effective. They will still feel pain right here. Now this is with cord it on the right path because when you're in this position, the hand is like this, and when you're like this, the muscle right here that go from here to here, and that'll target with claws. Now the issue here is that we want to target this range of motion. When you do with claws, pretty often people will do it like this. Sorry, I'll be like this, and that's not specific enough position or will target different muscle than the medial elbow pain. So the first thing we need to do with core, we want to make sure that the arm is straight, and then we want to really emphasize this range of motion all the way back here, core all the way back to make sure that it hits the muscles that we want to hit. This is assuming that it's the muscle related issue. I've seen some people have pain right here and jerk overhead, and it's nerve related. In that case, I would suggest doing a nerve glide to see if that will help or not. I will do or not nerve glide, which will look like I will also look. I need to review this. I will send the video to you, but I don't want to demonstrate it to you and have it slightly off. So yeah. No, Baz, I'm talking about conversation with Hamza. Um, but yeah, yeah, okay. I will. I did not see the question you asked me about for your own letter. Do you mind typing it out so I can answer the question for you right now? Oh, okay. All right. Okay, so I'm gonna go ahead and end the webinar now, and if you need help, or if I can help you improve your own. Oh, okay, I got it. Okay, so if you feel like if any of this sounds familiar to you, just reach out to me, message me. I want help, and let's work together to help you. Okay, thank you for coming to the webinar, and then have a good day.